The state of New York is facing a massive homeless crisis with levels not seen since the Great Depression. With thousands of homeless people living in crowded cities, the coronavirus is posing a threat to the health of those who may sleep in the subways or on the street. Joining us to discuss this further is Michael Fischer, the president of New York's Central Park South Civic Association. Thank you for joining us.
My pleasure. Good morning.
Good morning. Mayor Bill de Blasio stated that New York City is working on an effort to help homeless individuals and see if they show any symptoms or sign of the coronavirus and get them health care. But how does the local government plan on accomplishing this type of task to stop the spread of the virus?
Well, first of all, that's news to me about what the mayor says he's doing in the city. I mean, I was walking around the other day throughout the city and last night, and there's been no attention whatsoever paid to the homeless people on the streets at all. So I don't see that, and I don't see the city really addressing the issue on the streets. I mean, they may be addressing the issues where there are people that are actually, that are actually inside being helped, but the people on the streets themselves, the mentally ill, are not receiving any types of attention whatsoever, that I see at least.
Interesting, which brings me to my next point, where the coronavirus, of course, is causing concern for officials, even outside of New York City, of course, as well as cities in Los Angeles and Seattle, where thousands of homeless people oftentimes live close to each other and commonly without proper hygiene. How does this make the homeless more vulnerable during this sort of pandemic?
Well, first of all, the homeless are twice as likely to catch the coronavirus. I mean, they have very weak immune systems. Many of them are very ill on the streets. I mean, temperatures are very, very cold. And, they're lying on the streets. I mean, I was in a subway 2 weeks ago, and there was some coughing on the subway cars. I mean, they're laying all over the subway cars. They're all over the train stations and everything. I guess the only good news is that people are staying in now, and they're not going in. A lot of people aren't taking trains. As far as I'm concerned, if you have, unfortunately, I hate to say this, but if you have homeless people that are laying on the trains, on the subways, people shouldn't take the subways. It's very, very dangerous. I mean, we shouldn't underestimate how dangerous the coronavirus is. It's very, very dangerous. I mean, if you're sitting in a subway and somebody coughs and you happen to breathe in the drops in the air, you could catch it. So it is dangerous.
Certainly problematic, which is why this whole social distancing and quarantining ourselves is what officials say is so crucial to avoid this spike in hospital cases. But there are currently about 500,000 homeless people living across the country. What should elected officials and lawmakers be doing to ensure that vulnerable groups are not falling victim to the coronavirus?
Well, what they should be doing is what they should have been doing 2 months ago. I mean, what they should have been doing 10 years ago, 5 years ago. I mean, they've let this crisis get way out of control. I mean, you have thousands of people that are laying on the streets, defecating in the streets. It puts the public in a very dangerous and unhealthy situation. And, 2 months ago when we heard about the virus, they did absolutely nothing. I mean, they're doing absolutely nothing now with the people in the streets. They say that they're, trying to move people off the streets, but quite frankly, unfortunately, the optics of a lot of the progressive politicians is that if they don't want to move off the streets, they don't move them off the streets. So most of the people that are, mentally on the streets will not move off the streets, presenting a very dangerous situation for the public and for themselves. And the scary thing is that this disease can spread like wildfire. We don't know how many homeless people are carrying this disease right now. And, it could be a very, very, very bad situation for all of us, including the homeless. I mean, we don't want to see anybody lose a life.
Absolutely. We know that the homelessness problem, it's already been a challenge for mayors and local governments, but now it poses an even bigger challenge, as you mentioned. Michael Fischer, the president of New York's Central Park South Civic Association, thank you so much again.
My pleasure. Thank you.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.